So basically, I received my degree in neuroscience from a pharmacology department. So really, actually, my PhD says pharmacology with a neuroscience emphasis. And the first principle in pharmacology, the first thing I ever did when I did a rodent experiment using rats and looking at a drug to see what an effect was to determine whether there was a dose-response effect. That was sort of the beginning of pharmacology for me, was if something was causative, you would see a dose response. And actually, that's what you see with marijuana use in schizophrenia. Those who use more frequently and those who use heavier concentration products are much more likely to develop schizophrenia. Then there's also this concept that the proponents will bring forth again, maybe the psychosis came first, and actually 3 large prospective studies in Europe, where, as I mentioned before, this is where they do most of the epidemiology because they have centralized healthcare systems which allow such studies to be conducted. They have studied teens, large, couple thousand teens aged, say, 15 to 18, and they follow them for many years, and they ask the question, did they have psychotic symptoms and then they develop a marijuana habit, or vice versa? And consistently they find that the marijuana use came before the psychosis. There's some evidence for self-medication in the sense that when someone becomes psychotic and they lose insight as to what is causing their psychosis, they can continue to use, and they may use more because they don't understand the harm that it's doing. In individuals with schizophrenia, those who are marijuana users have an earlier age of onset. So this is similar to carcinogens causing an earlier onset of a suite of cancers. Marijuana does that for schizophrenia. When you isolate the active ingredient of marijuana, delta-9 THC, and you administer it in the clinic, you can elicit psychotic symptoms while a psychiatrist is monitoring the outcome. So, very controlled environment, you will see psychotic symptoms. In general, the proportion of people when it's such a concentrated dose are about 40%. They will experience paranoia, delusions of grandeur, racing thoughts. Now, this study was incredibly important because it was so large. Nearly 19,000 subjects in Finland who developed a type of drug-induced psychosis, any type, LSD-induced, PCP, methamphetamine, cocaine, amphetamine, heroin very rarely causes psychosis, but it can. And at the very bottom of the list was alcohol. But what they were asking was, what is the likelihood that each type of patient will convert to a schizophrenia spectrum disorder? And the likelihood was greatest for marijuana above all of the drugs. About half of those who develop what can be considered a temporary drug-induced psychosis. In other words, when they stop using for a while, they're able to recover. But if they keep using, about half